talk about this concerning trend during the pandemic, another one that we have to worry about, the rise of some drug-resistant infections. We're talking about bacteria and fungus. There are several types that have taken root in medical settings, and some experts worry the problem got worse just within the past year.
It's crazy to be talking to us about something other than COVID-19, right? Well, to talk more about this and to educate us about some of the issues here, we welcome Dr. Suman Radhakrishna. Dr. Suman is the Director of Infectious Disease with Dignity Health California Hospital. Doctor, thanks for joining us.
And Doctor, thank you so much. We've heard this before. Now we're hearing that this problem is getting worse. What are you seeing?
Thank you for having me. We did have this problem before COVID. It will still be there after COVID is eradicated. When people are given too many antibiotics or have received courses, many courses over time, they develop resistant bacteria. And we have so many people in the ICU. Then we had the PPE crunch, and all the skilled nursing facilities had problems with COVID, and they had to be transferred to the hospital. So they went back and forth, and it seemed like a continuum of people traveling between the hospital and skilled nursing facilities. And this increased the incidence of these resistant bacteria. For most part, they're not as pathogenic, but because our patients are sicker, who are in the ICUs, patients who are in skilled nursing facilities are sicker, and so it can potentially kill them because we do not have great drugs to treat them with. And the ones we have so many side effects that sometimes the cure is worse than the illness.
So what specifically are they dealing with, doctor? We're talking about a bacterium and also possibly a fungus, and it seems like our medical professionals are so hyper-focused on COVID-19. Is it difficult for them to really identify that there is an issue here?
No, we are focused on COVID. We're also focused on other bacterial infections, because when patients come in with fever, it can just be COVID, or it could be COVID plus some other infection that they may have, such as a urinary tract infection or some other bloodstream infection, or even long-term COVID patients can get secondary bacterial infections because their immune system is so down, and we're giving them the steroids. When they spike a temperature, we check them for cultures, and we find out. And once it's found out, of course, they are isolated. But it's between the time that they are diagnosed with these resistant bacteria and isolation that it is important that we follow all the infection prevention guidelines, such as, wash your hands, use a hand sanitizer. Now we do not have shortage of PPE. Having said that, it isn't like we have an overabundant amount of PPE either. So there has to be prudent and judicious use of PPE in order to prevent these infections from spreading from patient to patient. We're also very carefully monitoring patients so that they don't get unnecessary antibiotics for a viral infection and symptoms associated with COVID, which is a viral infection.
So when we say medical settings that this is a problem, obviously we're seeing these images from hospitals, but also this is happening at outbreaks in nursing homes.
Yes, these are outbreaks that are happening in nursing homes because the nursing home patient is typically older, has more illnesses. They're more likely to have been in and out of hospitals, seen different doctors for different illnesses, and have received antibiotics either for pneumonia or a urinary tract infection, which increases their risk for these resistant infections. It can be fungus, which is Candida auris. We have a very strong surveillance system, and anytime patients from nursing home are admitted to the hospital and have a history of Candida auris colonization, then we are very careful. We isolate them from get-go, check them, and what we call as surveillance cultures to see if they're still colonized with Candida auris, and take all the necessary precautions so that we don't transmit it to somebody else and cause illnesses in other individuals.
Right. Well, the good news is that we've been doing this for some time, doctor. So as you said, take the necessary precautions, wear your face mask, and be sure you're washing your hands very thoroughly. Thank you so much, Dr. Radhakrishna with Dignity Health. We appreciate your time.
Thank you, doctor.
Thank you.